Welcome back to Daytime. Well, did you know that caring for your teeth may mean that you are caring for your heart? Well, it's true, and Dr. Mark Bishara is here to explain it all. Welcome back to the show.
Thanks for having me again.
Well, you know, we're going to talk about our mouth health, but we're also going to talk about how our mouth health correlates with the health of the rest of our body, and I think this is a really fascinating topic. Most of us probably brush our teeth. Some of us floss, and I have to be honest, I'm very lazy about flossing, and I probably shouldn't tell a dentist that, but I am. You know, maybe a mouthwash once in a while, but I don't think a lot of us think about how the health of our mouth impacts the rest of our body, but it really does.
For sure. I'd like to think of the mouth kind of as the gateway to the rest of our body, and whatever we eat or consume that day actually has a direct effect on the rest of our organ system.
Oh, really?
Yeah.
That's a great way to think about it. So this is the gateway to the rest of our body, and anything that goes in there affects everything else.
Mm-hmm.
So, you know, if we're not brushing, if we're not caring for our mouth, not visiting our dental professional, can we actually be harming the rest of our body?
It depends on how long the bacteria builds up in your mouth. So if you, say, forget to brush your teeth over one night, nothing would probably happen. But over a period of time, as that bacteria builds up in your mouth, it can have a direct impact on the rest of your organ systems.
Well, we have some pictures we're going to look at, and I think that these pictures will help our viewers understand what we're talking about. And so walk us through this first picture that we're seeing.
So in this first picture, we see what a healthy mouth would look like on the far left. And in the next picture over, you see what we call gingivitis. Actually, if you can go back to that one slide there again.
There we go.
There we go. So in that second animation there, it shows what gingivitis is. And gingivitis basically means inflammation of the gums. So say you did not brush your teeth for a week or so. You may notice that you may have some bleeding around your gums.
That's right.
And the good thing is that gingivitis is a reversible process. So if you brush your teeth again and make sure that the gums are taken care of, then gingivitis actually goes away.
Okay, so if we look back at that picture again that we just had up, we had the normal healthy tooth, then we have the gingivitis, but then we have when it gets a little bit worse.
Okay, so now say that bacteria and food stays on in your mouth for longer than 8 hours. Then what happens is the foods that we consume actually start to harden and actually stay on those teeth surfaces. And what happens over time is we develop something called periodontitis. And that's actually inflammation of the housing or foundation that holds these teeth in place. Periodontitis is actually a process that is not reversible. So over time, we can find that teeth can actually start to be either sensitive, the teeth can actually start to loosen over time. Loosen over time.
Wow.
Yeah.
That's scary. So this is, you know, weeks and months of not caring for our teeth properly.
Yes, it's actually it's a slow process. So once we see someone in either stage, we try and stop it at that stage.
Okay, so there is something that can be done.
Definitely.
If you're getting into that stage. And we have another picture that we want to show. And I believe that this is kind of going to explain what happens when bacteria gets into our bloodstream. So I'll let you take a look at that.
Sure. And in this picture, we see what happens over time as plaque builds up on these teeth. What happens is our body creates inflammation. Inflammation is a natural response by our body to any bacteria or you know, anything that it does not want to have there. So what happens is this inflammation can actually start to travel from the tooth surface actually into our bloodstream and directly into other organs like into our heart.
So I think that leads us to our next picture, and this is going to show us what happens when we've allowed bacteria to get into our bloodstream over and over again.
So in this picture here, we have a normal artery, and what happens over time is as this inflammation travels from the bloodstream into the heart, you get a constriction of that artery. So what happens is this plaque makes it that much harder for the blood flow to travel through that artery.
Oh, because now the blood is squeezing through such a small amount of space.
You got it. So what happens is our heart has to work that much harder, and if we're not getting enough oxygen and blood flow throughout our body, you could be risking things such as, you know, a heart attack down the road.
Wow, and that's all due, well, not all due, but in big part due to not caring properly for our mouth, because as you said, that's the gateway to the rest of our body. Well, doctor, I appreciate now that we've laid the groundwork, because when we come back from this break, we are going to talk a little bit about what we can do to actually protect our mouth, how to care for our mouth, how to make sure that that bacteria is not getting into our bloodstream and that plaque is not building up. So we do have to take a break, guys, but more with Dr. Bishara right after this break. Welcome back. Well, we are here with Dr. Mark Bishara, and we are talking about the health of your mouth. And before the break, we walked through some pictures to show what can happen if over years, and I think that's important for us to emphasize, over years of not caring for our mouth, not brushing, we allow that bacteria and plaque to build up. And we saw what really can happen, not just in your mouth, but in the rest of your body. So now we're going to talk about how we can prevent that from ever happening. And I think probably the most common way we could prevent that is by brushing.
So certain recommendations are definitely to brush twice a day, in the morning and at nighttime. And also, one key thing I find is people don't drink enough water.
Does that really make a difference?
So a lot has to do with the amount of saliva flow that happens naturally in our body. And for some people, they just don't produce enough saliva. So if you're keeping yourself hydrated with water, then the foods that we consume or things that we may be drinking throughout the day, then at least we're rinsing out all those, bacteria-causing foods and drinks, right?
Yeah, that never dawned on me
Yeah.
before, but it makes perfect sense when you're describing
Yeah.
it. So we can wash our mouth out, essentially, by drinking a lot of water. We're going to brush at least twice a day. Tell me, how important is flossing? Because you know that I'm a lazy flosser.
So often you'll ask people at the dental office, how often you're flossing, and it's one of those things where at times we may not be doing enough of it. The key thing with flossing, though, is that we are getting into areas between the teeth, which the brush just cannot reach. So what happens is that if we have foods that could be accumulating between teeth, we want to remove it with the floss before it starts to harden, and then go through that process where it starts to affect the teeth.
Okay, so assuming, that we take decent care of our teeth, we're brushing at least once or twice a day, we're flossing more often than Sarah does, and, we're drinking water,
Yeah.
we don't need to be as concerned about, that bacteria or that plaque, which would travel from our mouth into our bloodstream, but not everybody does care for their teeth that way. So what are some steps that can be taken if you notice some of your teeth are a little bit loose, if maybe you haven't been brushing the way you should be, or haven't been caring for your mouth over a period of years?
I would say a lot of the conditions that happen in our mouth also have a direct link also with other health factors. So it's good to also see your medical doctor and see if there's any things that may not be noticed.
Oh, really?
For example, someone may have a history of having high blood pressure, for example. There may be a genetic link with that. There could be other factors such as smoking that could also contribute to having teeth problems.
Oh, that's fascinating, though, to think that, we're talking about how your mouth affects the rest of your body, but the rest of your body can in turn affect your mouth.
Correct. So, and a lot of the studies, they've shown that there's a direct link between our mouth and our heart, but it also goes the other way, where other factors that are not directly in the mouth, but they also have an impact on what's happening in our mouth.
Such as?
Just things such as someone being a smoker. If someone's a diabetic, then they're going to have a slower healing response to that inflammation, so that their body's going to actually take a longer time to recover from, for example, food being in the area or bacteria building up in the area. So in that case, for someone who's a diabetic, we may suggest that they're in the office every 3 to 4 months for cleanings as opposed to, say, 6 months for a typical patient.
So what's the difference then between, me brushing my teeth at home and me going to the dentist and getting a cleaning?
So that's a good question. It all goes back to how far the bristles on your toothbrush can reach. And at home, if you are just brushing above the gum line, that's great for removing all that plaque above the gum line, but often on x-rays in the office, we will see bacteria has actually built up underneath the gum line.
Where you can't see it and your brush can't get to it.
Correct. So if that's left for too long, again, our body creates that inflammation response to try and protect itself. So if it's left too long, also you can start to get teeth problems, and then that bacteria travels through the bloodstream again.
So at the dentist's office, you're then able to kind of get underneath that gum line?
Correct. So that's the difference in how far that bacteria is, either if it's above the gum line or below the gum line. And it's not to say that every patient that we see has bacteria directly underneath the gum line. It just depends on how far their gum condition is at that point.
Oh, okay. Yeah. And that's, of course, why we need to see our professional. How often do you want us to come and see the dentist?
For a typical patient, it's good to come in every 6 months for a cleaning. And I would say that for, say, somebody who may be medically compromised, for example, a diabetic or someone who's a smoker or had past history of gum disease, it's good to be in the office sometimes every 3 to 4 months.
Just to make sure everything is good.
Correct.
I love it. Well, who knew your mouth health is directly related to your heart health, to your body health? Dr. Bishara, thank you so much for being here today. So much good information, and I'm going to work on my flossing for the next time you come so I don't feel embarrassed. No, we don't want you guys to go anywhere because we have to take a break, but there is going to be so much more daytime right after this, so make sure you stay tuned.